Hi, I'm Dr. Jacob Scheinerman. I'm chairman of the Department of Cardiovascular and Thoracic Surgery here at Lenox Hill Hospital, part of Northwell Health. I know this can be a frightening time for you and your family. We're here to assure you that our team is geared completely to provide the best quality care in open heart surgery of any program in the United States.
Your journey begins at the admitting area, where our compassionate staff will guide you through the check-in process.
I'm going to get some paperwork for you, and we're going to get you registered before you go upstairs. Okay?
Thanks very much.
Once you've completed your registration on the first floor, you'll be escorted to the third floor preoperative area. It's a seamless transition, ensuring you feel supported and at ease every step of the way. Nurses in the preoperative suite will help prepare you for your surgery.
So I'm going to explain to you what you're going to do today. First, we're going to get you undressed, put on your gown.
You will be given a gown to change into. Your vital signs will be taken along with blood samples. An EKG will be performed to establish your baseline heart rhythm. We will then bring your family member or escort in while you wait for the surgeon and anesthesiologist to talk with you before surgery. We encourage you to designate a healthcare agent ahead of time. This is a requirement prior to surgery. An agent is someone who knows your medical wishes and will carry those through if you cannot personally make them known.
So this paper here just says that we talked about everything. It says that you give permission to Dr. Patel to perform a coronary artery bypass grafting. This says that we talked about the risks.
You will have the opportunity to leave your belongings with your escort, family member, or our security team. These items will be returned to you in the recovery area. We encourage you to leave valuables at home and pack lightly. You will need to remove dentures, hearing aids, jewelry, and glasses prior to your surgery. You will meet your anesthesiologist in the preoperative area where you can ask about any concerns you may have. After addressing your concerns, the anesthesiologist will ask some basic questions about your medical history. They will also inform you what to expect when you enter the operating room.
You'll have a lot of people coming at you today. We're all here to take care of you, okay?
In the operating room, basic heart monitoring will be placed.
We got some cold, sticky pads to watch your heart rate and rhythm today.
And you will be given medications to reduce anxiety.
Once the IV is in place, I'm going to give you some numbing medication, some sleep medication. You'll drift on off to sleep. We're going to have you breathe oxygen from a mask. Promise you you're getting all the air you need. Okay, we're going to hold it nice and snugly on your face, and Lena's going to hold it for you. I'm delivering the medication now. You'll find yourself drifting on off to sleep. Got a big team all working here today. We're all Team Gary.
At this point, you will begin to drift off to sleep. After you are completely asleep, a urinary catheter will be placed in the OR to accurately measure your urine output. Another catheter will be placed in your wrist to measure blood pressure. A third catheter will be placed in your neck under ultrasound guidance. This catheter enables us to monitor pressures within your heart, as well as provide you with medication. After the surgery, an anesthesiologist, respiratory therapist, and physician assistant will transport you to the 9th floor ICU for the recovery period. Most patients are brought into the ICU sedated, and the breathing tube is removed shortly after arrival. A critical care nurse, critical care doctor, and physician assistant or nurse practitioner will meet the rest of your team and comfortably settle you into your room.
Thank you, team. Then Dr. Zank, if it's okay with you and the team, shall we time out for cross-check?
The team will monitor and maintain your vital signs with the necessary medications. You will most likely still be sedated at this time, and your breathing tube will likely still be in place. The interdisciplinary team in the ICU will monitor your overall well-being. We will utilize the information from the catheters placed in the operating room. We will also assess hourly urine output from the urinary catheter, along with other tests and lab values. In addition, the surgeons will place chest tubes during surgery that drain fluid and blood so it doesn't collect in the chest. Pain after open heart surgery is expected, and your medical team will be there to assist you and manage any pain you may have from your incisions or from the friction of the chest tubes. As a team, we will strive to ensure a comfortable recovery from the anesthesia. When you are stable, awake, and able to follow commands, we will begin to wean you off the ventilator and get you ready for the removal of the breathing tube. We know this may sound a bit overwhelming, but be assured that you will receive the best care and attention possible for a speedy recovery. On the day after surgery, our nursing staff will assist you out of bed and into a reclining chair in the morning before the surgeons make their rounds. You'll be expected to take 3 to 4 assisted walks per day.
So you're going to scoot forward to the edge of the chair and then go ahead and stand up and grab onto the monitor.
This has been medically proven to be the best way to a quick and smooth recovery.
How are you feeling?
Good.
Good. You'll start to get stronger every day.
Our physical therapy team will evaluate your first day out of bed to establish your post-surgery mobility and assess any specific needs.
We're going to do some chest PT and try to help you cough. Okay, so take a pause here.
We will also tap on your back to loosen secretions in your lungs, making it easier for you to cough them up and help to prevent pneumonia. Your mouth will likely feel dry. For your safety, we'll wait 3 to 4 hours after the breathing tube is removed to do a swallowing test, ensuring your swallowing reflex is intact.
I'm going to give you a small sip of water so we can safely assess if you're ready to eat or drink.
For certain surgeries, an official evaluation from our speech and swallow team may be necessary. Patients are sometimes at a higher risk of getting blood clots in the hospital, especially after surgery. To prevent complications, we place a pumping device on your legs to circulate blood flow, and you will be given heparin, a blood thinner to prevent blood clots, every 8 hours.
This is an ascensive spirometer. We give this to patients to do a workout of their lungs to prevent pneumonia.
A spirometer will be provided to further strengthen your lungs. The spirometer increases the volume of air that you can take into your lungs over time and should be used 10 times an hour while you're awake.
So you're going to take deep breaths in. This should rise. Why don't you try?
To further comfort you, you'll receive a pillow to squeeze against your chest to reduce any potential pain, especially when you have to cough.
Give this pillow a squeeze and it'll help alleviate the pain in your chest.
Multiple wires and tubes will be attached to you, so it's important that you utilize the call bell to alert staff anytime you eat or need to use the bathroom. We want to promote your independence, but for your safety, our nursing staff needs to assist you.
I'm Jenna. I'll be your nurse tonight. I'll be checking on you throughout the night.
Anesthesia may sometimes cause nausea. We ask you to eat slowly once it is deemed safe. A member of our food services team will take your meal orders for breakfast, lunch, and dinner. Along with other lab values, your blood sugar will be closely monitored. The stress from surgery can cause your blood sugars to be high, even if you don't have much of an appetite.
I know your appetite is low, but it's important to eat because the protein will definitely help with the healing of your incision.
We also encourage a heart-healthy, low-sodium diet after your surgery. Finally, keep in mind that certain pain medications can cause constipation, so we will offer you stool softeners and laxatives to prevent you from straining in the bathroom. The length of your stay will vary based on the type of surgery you've had and your personal recovery speed. Once the critical care team deems you stable and determines that you do not need frequent monitoring, we will move you to our step-down unit, which is a semi-private room.
You're doing so well. So proud of you. I think it's time we can move over to the step-down unit across the hall. Congratulations.
Our medical team works diligently to keep your stay as restful and comfortable as possible. Often, our monitoring machines will alarm to alert us to any changes in your vital signs. These alarms, along with our staff's frequent assessment, though necessary, may impact your sleep. It's recommended that you bring headphones if you are a light sleeper. Please know that the night shift staff is committed to making your sleep as restful as possible. For the safety and respect of your fellow patients, please keep a limit of 2 visitors in your room during daytime hours and 1 visitor during nighttime hours. Our goal is to make you feel as comfortable as possible. We sincerely thank you for trusting the staff at Lenox Hill Hospital. We look forward to caring for you.
It's truly a privilege to be involved in your care. We're here to be sure that you do extremely well during your hospital course. If there are any questions or concerns for you or your loved ones, please feel free to reach out to us. Thank you for choosing us at Lenox Hill. We take that responsibility extremely seriously.